Hello. The deep muscles of the extensor compartment of the forearm has got 5 muscles. One is the supinator. Number 2 is the abductor pollicis longus. Number 3 is extensor pollicis longus. Number 4 is extensor pollicis brevis. And number 5 is extensor indicis. So, I will demonstrate all these muscles on the cadaver, their origin, insertion, nerve supply and the action. Now, the deep muscles of the extensor compartment of the forearm. As I mentioned you, we have 5 deep muscles in the extensor compartment. The first muscle is, as I am reflecting the superficial group of muscles, okay. These are the lateral group of superficial muscles and this is the extensor digitorum. When I separate these two muscles, you can see this muscle, this one. So, this is the supinator muscle. The supinator muscle, it takes origin in, it has got two fibers, the superficial fibers and the deep fibers. The superficial fibers of the supinator muscle will take origin from the lateral epicondyle. It also takes origin from the radial collateral ligament and also from the annular ligament. The deep strata muscles, if you see, they take origin from the supinator crest of the ulna. And insertion of this muscle, it is inserted into the upper 1/3 of the anterior and the lateral surfaces of the shaft of the radius. So, this is this muscle which overlaps both radius bone and ulna bone. So, this is supinator muscle and this muscle is pierced by this nerve. So, this is the posterior interosseous nerve. So, posterior interosseous nerve is a deep branch of radial nerve which supplies to this muscle and pierces the substance of this supinator muscle and enters into the deep compartment of the forearm to supply the other muscles. And action of this supinator muscle is, it extends the elbow and also it's a supination, it's a supinator of the forearm. Then moving on to the next muscle is this one. This is the abductor pollicis longus. Okay, this abductor pollicis longus, it takes origin from the posterior surface of both radius and ulna and also from the interosseous membrane. And insertion of this abductor pollicis longus, it is inserted onto the radial side of the base of the first metacarpal bone and the nerve supply is posterior interosseous nerve and action of this muscle is it abducts the thumb and extends the thumb. Then we have this muscle. This is the extensor pollicis brevis. This extensor pollicis brevis, it takes origin from the posterior surface of the radius and the interosseous membrane and this muscle, it lies medial to the abductor pollicis longus. So, this is abductor pollicis longus, it lies medial to this muscle. This is extensor pollicis brevis and this muscle, it gets inserted onto the dorsal surface of the base of the proximal phalanx of the thumb and the nerve supply to this muscle is again by posterior interosseous nerve. Action is it extends the proximal phalanx of the thumb. Next you have this muscle. So, this is the extensor pollicis longus. You can see this is extensor pollicis longus. It takes origin from the posterior surface of the shaft of the ulna and also from the interosseous membrane and insertion of this muscle, it is inserted onto the dorsal surface of the base of the distal phalanx of the thumb. Okay. And this muscle is innervated by posterior interosseous nerve and it also action of this muscle is it extends the distal phalanx of the thumb. So, this extensor pollicis brevis, it extends the proximal phalanx of the thumb, whereas this muscle which is extensor pollicis longus, it extends the distal phalanx of the thumb. Next we have this muscle. This is the extensor indicis. This extensor indicis muscle, it takes origin from the posterior surface of the ulna and from the interosseous membrane and this extensor indicis, it joins with this tendon. This is the tendon for index finger which is from the extensor digitorum. Okay, and this tendon will end up with the dorsal distal expansion of the index finger And the nerve supply of this is, it is supplied by posterior interosseous nerve, and action is it extends the index finger. Okay. So these are the deeper muscles of the extensor compartment of the forearm. Now here, to sum up, again this is the supinator muscle, number 1. Next we have this muscle, this is the abductor pollicis longus. Medial to that, this is the extensor pollicis brevis. Then we have this muscle, this is extensor pollicis longus, and we have this muscle which is the extensor indicis. So these are all the deep muscles in the extensor compartment of the forearm.